My name's Emma Cowley. I'm a lecturer at the University of Plymouth in Podiatry. I've got a special interest in musculoskeletal conditions. So these are conditions of the joints and the muscles and bones of the body. So I practice clinically, and I'm also an active researcher, and I teach. I've been doing it for 25 years. Musculoskeletal conditions are really important to address with people who are in occupations where they maybe are standing a lot, maybe for 50% or more of their day, or walking a lot. And the reason being that a recent study has shown that there's an approximately 1.7 times increase in the risk of developing a musculoskeletal condition with prolonged standing. In addition, if you are taking days off work, the Health and Safety Executive reported that 24% of all days off work were taken off because of musculoskeletal conditions in 2017-18. So this is a really big problem. It has a socioeconomic impact on our society. It also obviously impacts the individual who has to take their own days off work and suffers the pain and discomfort of having these conditions, which are often long-term conditions as well. So the reason some people get musculoskeletal conditions and other people don't is simply because human beings are very complex. So our lower limbs, and in fact our whole body, is made up of multiple systems, and they all work together. And likewise, they can all go wrong as well, and sometimes that interaction of when things go wrong can lead to pain and conditions. So often what I will see as a clinician is somebody coming in complaining of one thing, but actually when I assess them I realise it's a number of things contributing to their pain. There's also the factor of age and what the conditions somebody might be working in. All these kind of things can add into the susceptibility to developing a problem. So there are some conditions, for example, some women over 40 might experience some lowering of their arch in their foot, which would be this area just here, and that might be something that ends up becoming quite a nasty chronic problem with associated pain and possibly the need for surgery as well. But not every woman over 40 gets that. There might be other factors that could lead to this condition as well, such as having diabetes, having hypertension, which is high blood pressure, being overweight, that kind of thing. How could insoles help? Well, that's a really good question, because insoles are a really useful therapy to anybody dealing with foot pain, any clinician managing foot pain, and also people wanting to manage their own foot pain. They might go off to a shop and maybe buy a shop-bought insole that could help them. So some insoles are really useful just from the point of view of covering the bases, if you like. Some people's conditions are very easily managed. If they've only recently had the conditions develop, then often a shop-bought insole or something inside a shoe already built in will be enough to resolve those symptoms. But other times conditions have been going on a bit longer, they're a bit more chronic, a bit more progressed, and they need a clinical assessment and that prescriptive insole that I would be looking to give them, maybe with some other therapies as well.